Dear colleagues, almost every dentist who creates a direct restoration of a posterior tooth faces a problem. During the final occlusal correction of the chewing surface of the restoration, the correct morphology turns into a smooth, flat surface. Is it possible to create the correct tooth morphology and precise intercusp contacts without grinding them off at the final stage of the restoration? Yes, it is possible. In my video, I will show you an interesting and simple restoration technique, which I am sure will be useful for you and your patients. In this clinical case, the patient has a large carious cavity after a large old restoration fell out, and my task was to restore the posterior tooth of the lower jaw with the creation of the correct morphology and intertubercular contacts with the antagonist in the upper jaw. Step 1. Make an occlusal bite ridges on both sides. Why not bite ridge on one side only? Because the patient in 90% of cases will shift the lower jaw towards the bite ridge and we will get incorrect contacts of the restored tooth with the antagonist. Step 2. Obtaining a silicone impression of the antagonist teeth. For this purpose, I use a shot impression tray, as the walls of the tray create compression of the silicone, and the impression is accurate. Step 3. Making the plastic model of antagonist teeth. To do this, I use a quick hardening plastic which I put into a silicone impression. It is very important to keep the nozzle of the mixing gun constantly immersed in the plastic during the application of the material, to avoid the formation of air pores on the chewing surface of the antagonists. Step 4. When curing fast hardening plastic, a sticky layer forms on its surface, which we remove with alcohol. Then, we check the position of the model on the teeth of the lower jaw. Step 5. Precise positioning of the plastic model on the teeth of the lower jaw using the bite ridge. Without bite ridge, the model may move slightly or create an incorrect lean to one side or the other. During the restoration, when constructing the morphology of the chewing surface, we will be guided by the model. So, it is very important to create a stable and uniform position of the model on the lower teeth. To do this, we use a fluid composite to create an accurate fixation of the adjacent teeth from the restored one with the teeth of the plastic model. Step 6. Removal of excess model resin and flowable composite and rechecking the position of the model on the lower teeth. Step 7. Anesthesia, preparation, isolation. Step 8. Checking the position of the plastic model of the antagonists on the lower teeth with rubber dam and clamps. Step 9. Continuous use of the antagonist model in the stepwise modeling of morphology. First of all, we take the modeling liquid and apply it with a brush on the chewing surface of the antagonist tooth to block the bonding of the model with the plastic restoration composite that has not yet polymerized. Further, in the process of modeling each morphology detail before its polymerization, we put the model on top, press it, and bring this morphology detail to contact with our model. After that, we remove the model and polymerize the finished restoration detail. And so, step by step, detail by detail, we create an exact morphology immediately in occlusion. Step 10 is the final check of the stability of the model. If the model is located on the teeth exactly, without play and mobility, then you did everything right. If there is mobility and play, this is a reason to carry out a correction before removing the rubber dam and clamps. As a result, we get the ideal morphology right away, and it does not need to be grinded to obtain an accurate occlusion. Just need to be polished. And in conclusion, 2 points. First, many dentists consider this technique complicated and long, but in fact it is very simple. The most important thing is that the restoration is almost 100% accurate in occlusion. And second, before you start working with patients, practice manual skills on plastic or plaster models. Sincerely, Dr. Krutikov.